In this week's episode, let's try to understand how India has botched up its vaccine policy and how we, the people of this country, ought to learn certain civic behaviors in this pandemic and for the future of this country. A messed up vaccine policy. That's what has affected most of us today in this pandemic as we are trying to book the slots on the COVID app, either because of technical glitches or because of failure to register for the vaccine or vaccine shortages that are reported from across the country. There's a lot of confusion on the vaccine crisis. Moreover, this confusion is added because of the new rules that government of India releases every week, apart from the PM's monologue or his weekly Man Ki Baat. Now, here's a bit of context before we actually go into the details of this. The National Expert Group on Vaccination for COVID 19 in 2020 declared that the center will take full control and advised states not to chart separate pathways of procurement. Then, in April 2021, the center completely came up with a different policy altogether. And that is, the center put the onus of vaccinating 600 million between the age group of 18 to 44 years entirely on the states and private hospitals. As a result of its April 2021 policy on vaccines, while the center claimed it is liberalized and a very acceptable vaccine policy, what it has done is brought down the vaccination rate in the country. Unfortunately, if you track the data from April to May end, it is clear that the number of vaccinations across the country have drastically fallen down because of this new policy and by putting the onus on the states to procure vaccines. What was worse amidst all of this was the government of India claiming a lot of lies. Now, that came out through a press release by Niti Aayog, which stated that no major country in the world is vaccinating its children, and it also had other questionable arguments. But the most stark claim from this press release by the government was the central government is doing all the heavy lifting, from funding vaccine manufacturers to give them quick approvals for ramping up production, while the center claimed that it was the one that was doing all the heavy lifting in the press release. What it merely did was facilitate the states to procure vaccines, in fact, on its explicit requests. But the states by then, by May, were very well aware of the challenges in procuring vaccines which were already being underproduced in the country. Moreover, they also demanded more decentralization in procuring vaccines from the center. Health being a state subject, the center at this point made it look like the liberalized vaccine policy was a result of the constant requests being made by the states so that it gives more power to states. In fact, the center made it look like the vaccination policy and giving free vaccines was like doing Indians a favor by actually doing all the heavy lifting on vaccines. In fact, most countries around the world have decided to go for a free vaccination policy for their entire population, unlike India. But if you go back to the elections that happened in 2020 in Indian states, the center, which is the Modi government right now, itself has promised to give free vaccines in multiple states. Now, going by this and the vaccine policy that is in place by the center right now, they're both contradictory, and the Modi government has gone back on its word of free vaccines for people. Interestingly, if you observe the recent appearance of PM on TV in declaring that the age group between 18 and 44 years will be provided free vaccines, It is a clear indication of how the government changes its vaccine policy based on its whims and fancies. For instance, this announcement came from the government of India only after the Supreme Court called the government's policy irrational and arbitrary. The government was also questioned by the Supreme Court about its 35,000 crore budgetary allocation for vaccines and why it could not vaccinate 18 to 44 years of age group for free. The center also made states fight for the vaccine procurement, while later the PM announced that the center will now procure vaccines and supply it to states for free. What should have been done in the beginning of the year with a well thought out vaccine policy for the country has been changed according to politicians' convenience. While we have the Supreme Court and the High Courts of states to thank for to at least putting some sense into the government on its decisions, either in terms of vaccine policy or in handling or mismanaging the pandemic, it shows clearly why planning an effective response is required in such dire circumstances. After all the bungling up of the vaccine policy and the mess that the center has created through confusing rules, here are a few effective response methods which could help the center. First, strategic monthly planning. Now, both center and states can initiate specific monthly schedules for vaccination. This will not only help in monitoring the progress of the vaccination, but it will also ensure transparency for greater trust and coordination between the center and the states. Second, targeted vaccination campaigns. Given the vaccine shortages across the country, high risk populations as well as potential super spreader groups among active and mobile populations need to be actively identified and vaccinated through an intensified campaign mode. Given that many are still unaware of the government's vaccination drive or have some apprehensions regarding vaccines, it is even more important to take this vaccination drive in an intensive campaign mode. 3. Countering the gender and income divide. There is a national gender gap of 4% in favor of men in India's vaccination program. The current data shows that only 4 states have a higher female to male vaccine dose ratio, while states such as Delhi and UP and other states have a male to female gap of more than 10%. Now, there's also an issue with rural urban divide here. For instance, taking advantage of the COVID app's accessibility, urban population or urban people are going to rural areas to get vaccinated, which is in turn causing shortage of vaccines in rural areas and villages. Therefore, it is all the more important to bridge this divide and ensure that those in the rural areas and smaller towns and villages get vaccinated too. Fourth, proactive procurement and expanding manufacturing capacity. Government agencies must start engaging constructively with vaccine developers and producers to anticipate the raw material requirements and ensure that the supply chain of vaccines remains streamlined. Fifth is focus on rural areas and preparing for new variants of virus and the upcoming third wave. Given the vastness of geography and the numbers that need to be covered in India, our system must be ready for the upcoming variants. And it should also plan for the impending threat of the third wave. So, while that remains the government's responsibility and its need to take action to save this country, we, the people of this country, also have an important role to protect and preserve our villages, our towns, our cities, and eventually our own country. From wearing masks to following social distancing protocols to trying to avoid gatherings or large public events, our actions, our behaviors, and attitudes have to be to ensure civic responsibility. Well, if there's anything that the pandemic has taught us, it is to live in a hygienic and a healthy way. Therefore, it's not just that the government has a lot to learn, but we, the people of this country, also have a lot to learn. And maybe the pandemic is our time to change. Thank you for watching this analysis. If you like it, please subscribe to my YouTube channel. Also, please stay safe and take care of your loved ones.